In this video, I'll go over some tips to help you survive your first PICU rounds. First of all, be present. Although this really applies to pretty much your entire rotation, in rounds in particular, I can't stress enough how important it is to actually be present and an active participant. None of us went into critical care because of an insatiable desire to spend hours perseverating about electrolytes in hallways, but rounds are an important part of our day in the PICU. During rounds, we discuss our plans and concerns, catch up with consulting services, and talk with families. It's a chance for staff and fellows to teach, and for all members of the team to learn. We were all trainees once, and I know it can be tempting to use rounds on your colleagues' patients as a chance to catch up on emails, write some notes on other patients, or tackle the day's Wordle. But to get the most out of your time in the ICU, I encourage you to stay focused on the discussion. There are things to learn from every patient, and I promise we'll be done in plenty of time to get to that Wordle. Next, listen to the nurses. This is Mike, demonstrating superior nursing care that you can find on our unit. The nurses have valuable insights that you just can't get from Epic. The bedside nurses can tell you what's working and not working for your patients and can fill you in on overnight events that may not have made it into the medical record. Similarly, parents and families obviously know their kids better than we do, and listening to their thoughts about how their kid is doing can be immensely helpful as you consider whether to escalate treatment or wean therapy, or whether you might be missing an elusive diagnosis. Next, use the checklist. The compliance checklist used to be a regular part of rounds. Many of us have gradually moved away from formally reviewing it at each bedside, but it's still a useful way to make sure you're not missing anything on your patients. The mnemonic addresses some standard elements of ICU care and helps ensure that things aren't being missed. The use of the checklist reminds us to encourage mobility, early enteral nutrition, and responsible medication use, and minimize unnecessary labs, ventilator days, and line-associated infections. We may not explicitly discuss each item on rounds, but if you can mentally review each of them before you present, your patients will undoubtedly benefit. Finally, and most importantly, if you don't understand something, ask. Don't be afraid to ask questions. Rounds is a great chance to clarify the rationale behind treatment plans or to work your way through complicated pathophysiology. Please don't hesitate to ask questions as they arise. We want you to be an active participant in your patient's care, and we may not realize that we're using unclear terminology, or we may just forget that you can't read our minds. Asking questions helps you stay engaged and helps us remember to spend time teaching, so it's really a win for everyone. The fact that this video exists might make you think that rounds in the PICU are particularly daunting or complicated, but I assure you that's not the case. Patients are maybe a little more complicated than those you care for on the floor, but the general mechanics of rounds are the same. You've got this, you're going to do great.